I like the variety. One of my colleagues that used to work with us here says that family doctors are variety junkies because it's not the same thing over and over again.
I feel primary care is the backbone for healthcare.
I see everything from newborns to elderly.
I can treat the whole family. I completed my residency in internal medicine and pediatrics, meaning that I'm trained as an internist and a pediatrician.
Having a one-to-one relationship with patients throughout their lifetime is so much satisfying.
I provide everything that you think of when you think about primary care, so preventive services, management of chronic conditions, and acute or sick visits.
You know, as a primary care physician, that's one thing that I love, is that I can manage almost any condition, and even if I can't fix it, I can usually stabilize it until we get the patient in with the VCU specialist who can.
The other thing I like about family medicine is there's an explicit attention to what people call the psychosocial aspects of people's lives, so that you get to know people as individuals, you get to know their families in many cases. So I have many patients for whom I am the doctor for every member of the family.
I was a wrestler in high school, and more recently I had a young high school wrestler come in with a very similar injury to what I had in high school, and he was very nervous about it. He thought it was a season-ending injury. When I shared that experience of having a similar injury in the time frame it took me to get back and the obstacles I faced coming back from the same injury, I think he left with a lot of peace of mind that it wasn't a season-ending thing, that we had a good plan for him, that we knew what we were doing, and we got him back in time for the end of season tournament. He did very well. Came for a follow-up afterward, and we ended up talking more about his performance than his shoulder injury.